Is Lawrence around?
Oh, hi. Good morning, sir.
Good morning, Lawrence. Welcome
Morning.
to the assessment center. I'm here to assess your skills and competence. What I'm going to do next is to tell you the scenario and I will ask you to repeat it back to me. And then what we're expecting from you is to demonstrate to us your assessment and your intervention to this particular patient. Is that okay?
Yes.
Okay. So your scenario is this. You are the nurse looking after a patient called Mr. Smith. Mr. Smith is 68. He has undergone appendectomy 2 days ago and he's complaining of feeling unwell. And one of your nursing assistants reported to you that his vital signs were abnormal.
Okay. So I got Mr. Smith. 68. Sorry, I'm a bit nervous.
That's fine, that's
68
normal.
years old male who's 2 days post appendicectomy, and the nurse assistant told me that the patient's feeling unwell.
That's correct. And his vital signs were abnormal.
All right. Thank you. Before I start, I'm gonna do hand washing, and then I'm just gonna get my gloves and aprons after hand washing. Good morning, Mr. Smith. My name is Lawrence. I'm one of your nurse for today. Which preferred name you want to be called?
John would be fine, Nurse Lawrence.
John. Okay. Hi, John. How are you today?
I don't feel well myself, nurse.
Okay. Right. I'm just gonna do an assessment. So, gonna start with airway and breathing. So, John is talking.
Right.
So that means its airway is clear.
Okay.
Respiratory rate
His respiratory rate is 29.
29. Okay, so that's a bit high. Can I use a SATS probe?
Okay, you can.
John, just gonna put a SATS probe your finger, yeah, just to measure. Okay, so I'm just gonna put a SATS probe
Okay.
on the finger.
Okay, and as you do that, your monitor says unrecordable.
Unrecordable. Okay, so airway breathing. Can I auscultate? Is there a stethoscope?
You can, and what are you going to be listening?
For breath sounds.
Breath sounds. His breath sounds are clear.
Okay, breath sounds okay. So unrecordable. Can I try on a different finger just to check it?
You've tried, yes?
Yeah. So I've tried.
It's the same.
Sorry, John. Oh, it's unrecordable. I'm just gonna use a face mask, oxygen.
Okay.
So
And how much oxygen are you going to give
I'll
him?
put it on 15 liters.
15 liters. Okay.
Okay, John. Just gonna put a mask. Yeah.
Alright, nurse. Would that help me at all?
Hopefully, John, with your breathing. So you're breathing quite a bit fast. Okay, so I'm gonna reassess again. So airway, he's talking, breathing, still same rate,
Still the same rate.
29. Just gonna look at the SATS
It's
probe.
still the same. Nothing has changed, Lawrence.
Do I need to? Can I get another different probe, like ear probe, or
It's just the same.
same thing? Okay. So airway, breathing. So I've auscultated. Breath sounds still clear.
Directly, yeah.
Can I inform my nurse in charge?
You can do so. Yeah.
So just to a medical doctor.
Okay.
If it's
Would you leave your patient? at this point
no,
in time?
I could ask somebody.
Okay.
If there's a healthcare assistant around to call.
There is
There
a
is,
nursing,
okay.
nursing
So
assistant.
I can ask him or her, to call the nurse in charge or to call the
Okay.
medical
The nursing
team.
assistant happy to call the nursing assistant on your behalf.
Okay, alright.
Off he went.
Okay. Right, so while waiting for the doctor, I'm just going to continue the assessment. So airway, breathing, and then circulation. I'm just going to check the blood pressure.
Okay. His blood pressure,
Yeah.
it says 88 over 48.
88 over 48. Oh, that's quite a bit low. Okay, I'm gonna check the pulse.
Okay.
And what's the rate of the pulse?
The pulse rate is about 130.
130.
Yeah. Anything else you'd like to know? About the
If it's weak, strong.
It is weak.
This week, so 130. Okay. Um, okay, so I got the blood pressure. I'm gonna check the cap refill.
Okay. And
So-
how do you do that?
So I'm gonna level of the heart,
Okay.
and then I'm gonna press the finger nails,
Okay.
and then I'm gonna release it
Okay.
after
And it came back as 4 seconds.
4 seconds. So it's a bit delayed. Alright. I'm just gonna check if there's a quick access.
Okay. There was an access.
Yeah,
There wasn't any.
there was an
access.
access. Can I put an access now?
Yeah, are you
if
trying
there's
to do so?
Yes, I'm
Yeah,
trying.
yes, you can.
Okay, so gonna get the event form and everything. So I'm gonna, while taking the access, I'm gonna take some bloods as well
Okay.
for FBC, Usenis, clotting,
Okay.
and maybe cross matching.
Okay.
Or,
So,
so I'll send a full sets, and then I'm just gonna check the medical notes if there's any prescribed fluids.
okay.
That
Why would he need fluid?
well, I think because of his blood pressure is a bit low,
Okay.
maybe he's a bit dry and he's tachycardic as well.
Okay.
Okay, so I'll check the drug chart. So okay, so I'll check the drug chart. Just look if there's any fluids.
I think it's prescribed in front.
Okay, so is it a liter, a jello?
Yeah, it's a normal saline 500 ml flat
Okay.
dose.
Alright, so I can give normal saline. I'll put the normal saline here.
Okay. So whilst
Plastic.
doing that, let's assume that you put the IV fluids up
Mhm.
already. What part of your assessment are you in now?
I'm in letter C. So
Okay. Is there anything else you'd like to do?
for blood pressure. Oh, when I take the blood, I could send some AVGs as
Okay.
well.
That's
What else do I need? So airway, breathing, circulation, so blood pressure, heart. Oh, I could ask the nursing assistant as well if there's an ECG around
good. Okay.
because he's tachycardic.
Okay, you'd like to do an ECG on
Yeah.
him.
So just to be sure. Then I'm gonna reassess again.
Okay.
So airway
Still is
still the
talking to you?
same. Breathing. John, still fine. John, how's your
Still
breathing?
feeling well, nurse.
Okay, so still feeling well. I go with the circulation since I've given some normal saline. If there's any improvement with the blood
Not
pressure,
much change.
Not much change.
About 90 over 50 now.
okay. All right, so I'm gonna go to letter D. So, John, just gonna look at your pupils.
And what are you
Uh,
looking for?
The reaction.
Okay.
Yeah, so I'm gonna flash a light there.
Okay.
Yeah.
They're
And
both reactive.
yeah, both are active. Okay, John. So I'm just gonna check all the limbs if it's moving and everything.
Okay.
Oh, John, can you squeeze my hand, John?
Weakly he can.
Okay. Both.
Both, yes.
Both. Can you wiggle your feet, John?
He can.
You can. Oh, okay. Then I could check. Do we have a glucose machine?
We do have, but that was recently checked
Okay.
10 minutes ago by a colleague,
Mhm.
and it says 5.1 millimoles.
5.1 millimoles. Okay. Alright, okay. So, and then I'm gonna go to E. John's gonna check your temperature.
His temperature came back as 39.2.
39.2. So that's a bit high. So and then John. I'm just gonna look
Yes,
at your
yes.
wound site. Yeah. So I'm just gonna look the
Okay.
area where the post-op site is.
Okay, what are you looking for?
I'm just gonna look at the dressing if there's any dressing, and then the wound site.
There is a dressing, and as you peel off the dressing,
Okay, so I peel off the dressing. So I'm just gonna look if there's any redness around or
there
any.
is redness.
John, is it sore around? Is it tender?
Not quite, nurse.
Okay.
It's
And-
red and it looks inflamed, Laura.
Okay. So I think there might be infection going on with this wound. So I'm gonna call the surgical registrar
Right.
to assess the wound.
Okay.
And then, so the healthcare assistant can do that for me, or
He can do that for you.
okay, so he can blip the surgical
He
reg.
can close.
And then while waiting that, I could get some blood cultures as well
Okay.
sent off. And then what's next? Are they coming? Is the doctor coming?
The doctor's coming. Yeah.
Okay.
Well, is there anything else that you might do or assess on him, or are you happy with all those assessment and interventions that we provided before?
I think as well I've done blood cultures. Well, I'm gonna reassess again.
Okay.
So from airway breathing, still about same.
Mm-hmm.
Circulation, blood pressure did improve. So D, BMS is fine, and E. So with the I could do a wound swab
You can.
on the site as well. And then I'm gonna increase the monitoring of the heart rate, blood pressure,
Okay.
and then I can inform my nurse in charge maybe he needs a higher care or
Alright.
surgical.
Yeah. Thank you very much, Lawrence. That's the end of your scenario.
Okay, thank you.